Now today we'll be talking about amlodipine versus cilnidipine. Now we must know that amlodipine and cilnidipine, they both are calcium channel blocker. So what does that calcium channel blocker means? If this is a blood vessel, especially an arteriole, these are mainly made up of smooth muscle. This smooth muscle is a feature of arteries or arterioles because this smooth muscle layer is much less in veins. So veins are very thin and they have very thin layer of smooth muscles. So these smooth muscles causes vasoconstriction and vasodilation. So whenever they contract, there is vasoconstriction. So because of the significant vasoconstriction, because of increased tone of the smooth muscles, the vessels remain in contracted, constricted state. That is the reason why it will cause increased blood pressure. So these smooth muscles can be relaxed by relaxing the calcium channels. The calcium channel can be relaxed, and the vasoconstriction can be reduced. So automatically the diastolic blood pressure, the systolic blood pressure can be taken down or it can be reduced. So both amlodipine and cilnidipine, these are used as a calcium channel blocker in any patient who has high blood pressure. Now they have similar efficacy for blood pressure control. They have similar efficacy of blood pressure control. The only difference between amlodipine and cilnidipine is the amlodipine, which comes by very much famous brand like Stamlo or Amlokind or Amlosafe. These are the brands which very commonly has amlodipine. Now what they cause is that stimulate the sympathetic nerves activity, and so it causes reflex tachycardia. So reflex tachycardia is the problem with the amlodipine. So it can increase the heart rate. That is one of the problem with amlodipine, which is not there with cilnidipine. Cilnidipine won't increase this heart rate. It will not stimulate the sympathetic nerve activity, so it will not cause reflex tachycardia. Other things which this cilnidipine can do is it reduces the urinary excretion of the proteins. That is how uh, this has shown to improve or have some benefit for progression of CKD. So to prevent the urinary protein excretion, the cilnidipine is superior to amlodipine, and that too without affecting the creatinine. It has shown to reduce triglyceride levels, and it causes increased uric acid excretion. Now, this effect can be used for those patients who have high uric acid levels. Now, we must know most of the patients of high blood pressure, they are usually maybe on hydrochlorothiazide or chlorthalidone or Lasix or ditor, means furosemide or torsemide. They very commonly increase the uric acid in the blood. So whenever the uric acid is increased in the blood, very commonly they need to take feburic or febuxostat medicine to reduce the uric acid in the blood. Now in that instance, what we can do, we can simply stop that hydrochlorothiazide or chlorthalidone or furosemide or the torsemide, and we can start the cilnidipine. So what it will cause, it will reduce the serum uric acid level by increasing the uric acid excretion and reducing the absorption of the uric acid, which is caused by these medicines. That is the reason why this cilnidipine has a benefit in patients with hyperuricemia. Amlodipine very commonly causes pedal edema. That is the reason why it is one of the most common problem of bilateral lower limb swelling, which is usually pitting in nature. That is a very common problem of amlodipine, but which is significantly lesser or almost not present with cilnidipine. So if pedal edema you want to sort it out, cilnidipine is better. If uric acid you want to lower, cilnidipine is better. And if a patient's heart rate is already tachy like 100 or 104, 103, cilnidipine is better compared to amlodipine. Now, both the medicines have similar efficacy in blood pressure control, and both the medicines are usually given once a day. Amlodipine is present with dual combination medicine. It is very commonly present with telmisartan, olmesartan, and it is also present in triple combination with telmisartan or hydrochlorothiazide or chlorthalidone, or telmisartan, amlodipine, and metoprolol combination. The reason behind the reduction in the heart rate is the cilnidipine reduces the norepinephrine release from the sympathetic nerve endings, whereas amlodipine actually increases the sympathetic nerve activity, and then it causes the tachycardia. So, to reduce the heart rate, cilnidipine is better because amlodipine causes increase in the heart rate. This heart rate is reduced with cilnidipine, it is effective in morning hypertension as well as white core hypertension. Those patients, whenever they come to the hospital, whenever they meet any doctor, they automatically feel stressed, panicked out, and their heart rate and blood pressure increase. That problem can be tackled with cilnidipine because it will reduce the norepinephrine release from the sympathetic nerve endings, and it will counteract the white coat hypertension as well. The most important thing is about this amlodipine and cilnidipine that we must know is these both the medicines are excellent. They give 24-hour blood pressure control, and these are the medicines which are highly active in CKD. Means in chronic kidney disease, we have very much limitations. Usually, the furosemide, torsemide, or other diuretics usually won't help. Usually, telmisartan or using aldactone, it is very risky, or most of the time they cannot be used because of the creatinine issue or hyperkalemia issue. So, for CKD patients, we can hardly use beta blockers. We can use moxinidine. We can use prazopress or prazosine, and one of the most important medicine which we can use is this amlodipine or cilnidipine. So cilnidipine is excellent choice even in CKD patients. One of the most important thing that we need to know is whether amlodipine or cilnidipine, these both are CCB, this can be the first choice or first line of drug for any hypertension. May it be like in pregnancy also, amlodipine can be used. For any person who is stable or who has heart failure, uh, these medicines can be used. If the patient has CKD also, amlodipine or cilnidipine can be used. So any patient who has high blood pressure can be directly started on amlodipine or cilnidipine, and we simply have to remember this side effects of this amlodipine as pedal edema, tachycardia into the mind. That's all. Usual dose of amlodipine is around 5 milligram. Most of the patients are usually only on 5 milligram only, and for cilnidipine it is usually 10 milligram which is started. It can be given in 20 milligram dosage also. Many of the doctors, especially in CKD, they give up to 40 milligram of cilnidipine as well, but most of the time patients they are on usually 20 milligram of cilnidipine per day, and for amlodipine it is usually 5 milligram per day. That's all for now. Good day.